You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Okay, everybody, welcome to Healthline with 𝗥𝗲𝗵𝗹. It's July 31, Monday, here in Metro Manila. In other parts of the world, it's still July 30. But anyway, this is a show where we talk about medical questions. We try to uplift you by giving you information, and perhaps, like a lot of people, even myself, get educated with a lot of the topics that we talk about here on the show. And before we start off, I'd just like to say hello to Mitchell, who flew in from San Francisco, and he says he's back here now and he's watching it live in Manila rather than from San Francisco. And hello to Alessandra from Madrid. Okay, our topic today is diabetes, and 𝗥𝗲𝗵𝗹 has a wonderful diabetes center. And we actually have 4 guests with us today. So, I'm very excited to see how everyone will answer all our questions. And as we say, you've got questions, we've got answers. So we have 4 people that you can ask questions from. Do send in your questions during the show live. I know you can watch anytime on Facebook, YouTube, but do send in your questions while we're live so that we can get answers straight from the doctors and nurses who handle diabetes. So, first up, Dr. May Season. Hi, Dr. Season. How are you? I think we'd have to unmute. AJ, can you unmute? Okay.
Oh, okay.
Okay, there. Hi, Dr. Season. How are you?
Hello. Good afternoon.
Good afternoon. Okay. Dr. Mary Lourdes David. Hello. How are you today?
Hello.
Hello. Hi. How are you, doctor?
I'm doing good. For you?
Okay. Thank you for being on the show. And then we have Ivy Ramalosa. Hello, Ivy. How are you today?
Hello, I'm good.
Hello. Hi, Ivy. Okay.
Hello.
And we have Margarita Montealegre. I love
Good
your name.
afternoon po.
Good afternoon. Kumusta ka na?
Okay naman po, ma'am.
Yeah. I thank all of you for joining us on the show today, taking the time to join us and talk about this very important topic. A lot of people and a lot of Filipinos in recent years have, I think, diabetes has increased. I'm not sure. Please correct me anytime, doctors and nurses. And Dr. Season, may I ask you first, what is your specialty?
I am an internist endocrinologist.
Okay, internist.
Specialist.
All right. Dr. Season, can I ask you first to start off by telling us what exactly diabetes is?
Diabetes mellitus actually is chronic metabolic condition which is characterized by high blood sugar levels.
Okay.
It's either the body does not produce insulin or it's producing more than enough insulin, but the body cannot effectively use it. So it has something to do with insulin. Insulin is a hormone that regulates our blood sugar.
Mm-hmm. And doctor, what produces the insulin in our bodies?
Yeah, the insulin in our body is produced by what we call the beta cells in the pancreas.
Okay. So when it's diabetes mellitus, is that is that diabetes type 1?
No, we have diabetes mellitus is a term that we use to distinguish it from another kind of diabetes, which is diabetes insipidus, which is very different.
Okay. So, doctor, can we talk about the types of diabetes since there's more than one kind?
Yes, the 2 main types of diabetes are type 1 diabetes, wherein the body or the beta cells of the pancreas do not produce insulin anymore. So that is why this insulin has to be given externally in form of injection.
Okay.
And this type 1 diabetes is usually due to an autoimmune process wherein the immune system doesn't recognize these beta cells of the pancreas, destroying them, and thereby the blood sugar goes up very high.
Okay.
The other common type of diabetes is what we call type 2 diabetes. The type 2 diabetes is the one wherein the body has a lot of insulin, but the body cannot effectively use it. And so in the same way, the blood sugar goes up. So this is usually related to lifestyle, where when the patient is usually has a lot of comorbidities like obesities, like sedentary lifestyle, older age group, and usually because it's due to lifestyle, the treatment is also lifestyle change.
Yes, and we'll talk to the others on the panel today about lifestyle changes as well. We'll circle back to that. So, doctor, there are mainly two types of diabetes, and the type 1 is called diabetes insipidus.
No, it's type 1 diabetes.
Type 1, okay. Type 1 diabetes. Okay. So with that, what are usually the common causes of that, doctor? Are you born with it? Does it just occur at a certain age?
The type 1 diabetes, as I said, is usually due to an autoimmune process.
Okay.
That is, the body does not recognize the insulin-producing cells as native. And therefore, they are attacked by these antibodies, and the cells are destroyed. So that's why they cannot produce insulin anymore. So that's the cause. About type 2 diabetes is usually caused by extraneous factors, environmental factors, and the most common is insulin resistance. The insulin resistance could be due to various causes. The most common cause is obesity or being overweight. Because if you are overweight, you develop insulin resistance, and the excess, and especially if the excess weight is carried in the abdomen. So also, if you are sedentary, if you are not exercising, this sedentary lifestyle also contributes to insulin resistance, and it increases the risk of type 2 diabetes. And also because of the lifestyle, unhealthy diet, or consuming a diet high in processed foods, sugary beverages, and unhealthy fats can contribute to the development of type 2 diabetes. Of
Guilty.
Yeah. Also, family history has a lot to do. If your parents or your siblings are diabetic, there is a high chance that you will also become diabetic.
Okay. All right. So,
also, age. Sorry.
Yeah, no, go ahead, please, doctor.
Age. If you are an older person, you also risk your chances of becoming diabetes.
Okay.
And in some, it's due to some ethnicity, no? Southeast Asian people usually have a high risk for type 2 diabetes. But the highest risk are usually those who have those who are African Americans, Hispanic Americans, and as I said, Asian Americans.
Okay. All right. Thank you for that, doctor. So at least you gave us a demographic. I mean, I guess, did you say Southeast Asians? Do we fall?
Yes, yes. Southeast Asia. There is a high incidence of type 2 diabetes.
Type 2 diabetes. Okay. And of course, doctor, you mentioned one big factor is obesity, but you also mentioned the other factors around that, like how we eat or our lifestyle, eating highly processed food and all of that. So it could be, it's not just because, I mean, you got obese because you do these things, and then that caused it. That caused you to get diabetes. And doctor, what are the symptoms of diabetes? How would one feel? Okay.
The symptoms of diabetes will depend on your medical condition. For example, in type 2 diabetes, and in both type 1 and type 2 diabetes, the most common sign is frequent urination.
Yeah, okay.
Because of the high blood sugar, usually the urine takes out also the sugar outside the body. And because of the frequent urination, you become dehydrated. And most of the patients with early diabetes will experience thirst. And this thirst can cause dehydration and also because sometimes, especially in type 1 diabetes, the blood sugar goes out of the urine and you can have unexplained weight loss.
Okay.
And because of that also, because the body, although you have a lot of sugar, the diabetics have a lot of sugar, they cannot utilize it. So they feel that even if they eat a lot, they still feel hungry. So increased hunger is also one of the symptoms of diabetes. And diabetics are usually prone to infection. Because of the high blood sugar and also reduce the immune response of the body. And later on, for long-term diabetes, undiagnosed diabetics, they also experience damage to the nerves and they will start to have tingling or numbness like that and abnormal sensation in yes.
Is it usually what areas of the body do you feel that
usually it starts in the extremities, no? So that's why with what we call peripheral neuropathy, you have this tingling sensation in the feet, in the hands. And another symptoms is feeling tired, no? Just because, as I said, the body is not able to utilize the nutrients, especially sugar. And so because of that, this patient don't have enough energy. And later on, if the blood sugar becomes very high, they will complain of blurred vision. And if the situation goes further, then they will have a difficulty in healing their wounds. So there are so many symptoms of diabetes that if you are not diagnosed diabetic and you're already having these symptoms, you should try to have yourself checked already.
So basically, doctor, just to recap, if you seem overly thirsty, you pee a lot, these are some of the symptoms, and then you're always hungry, and you may not necessarily gain weight, so maybe you think you have a great metabolism, but actually, your body is not processing the nutrients correctly.
Yes, correct.
And, you also said you might start feeling tingling sensations, and it starts in the extremities, like the feet, maybe the toes, or maybe the fingers. Doctor, also you mentioned age earlier as one of the factors that could, why is that, doctor?
Because as you age, as a part of the aging process, there are also diminution of the beta cells of the pancreas. And also, as you grow older, you become more sedentary, so you're not able to use up your calories, and you become more overweight like that. And as I said before, sedentary lifestyle is one of the cause of diabetes.
And then, perhaps when you get older, as you don't move around so much, because you can't, you may have other illnesses, you just can't move around the way you used to.
Yes.
And so you can't exercise or whatever it is that you used to do, or, become a person with disability, then I guess the way to that is to consult. If you do have diabetes, then to consult people like yourselves in Makati Med, or go to your diabetes care center, and probably later they can tell us about diet, So doctor, what measures should one take to prevent diabetes in general?
Yeah, as I said, because of the type 2, we talk about type 2 first. No?
Yes, type 2.
If so, to prevent type 2 diabetes, you should maintain a healthy weight. So if you are overweight or obese, losing even a small amount of weight can significantly reduce your risk of diabetes. So we should try to focus on a balanced diet and regular exercise.
And regular exercise, yes. What do you think of the intermittent fasting diet that a lot of people seem to
Well, yes, intermittent fasting is usually used, yes, for weight loss. If you do it correctly, perhaps with guidance, then it is a good way of you will really lose weight. But it should be careful because it might also has a lot of complications if you are not guided.
Yes. And like, if you're not doing it properly, perhaps, or you don't know your whole history, what if your blood sugar drops? But I guess that's something that you in the diabetes clinic can deal with, no? And when we talk to other people on the panel, it's something that it's a question that can be addressed. So you've told us about the symptoms of diabetes, the common causes, and you're talking about type 2 diabetes because I guess type 1, doctor, it happens and then you have to deal with it. Though, are there tests that you use in your center or yourself to diagnose diabetes? How do you diagnose it?
Yes. First, of course, if you have those symptoms, then you might probably have diabetes. And to document it and to establish a diagnosis, you should have blood tests. So the number one is you should have a fasting blood sugar. That is the first test that you can have. A fasting blood sugar of around greater than 126 milligrams percent or 7 millimoles is highly suspicious for diabetes. But you should have at least 2 tests, not only once.
So, doctor, when you talk about the blood testing sugar, that's when you ask someone to fast for how many hours, doctor? Sometimes
usually we do it 10 to 12 hours.
Okay, 10 to 12 hours, and then they either go to they can go to your center for that. I assume.
No, they have to go to our lab.
Your lab,
with the blood test in our center.
Because that's the first step. And also Makati Med, I'm just reminding the audience out there that Makati Med has services also that you can have them go to your home to do that.
Yes.
To get your blood.
Yes, they can get your blood test. Sorry.
No, go ahead, doctor. Please don't apologize.
So if it's not definitive, but you still have the CDOS, you can have another test. It's what we call 𝗥𝗶𝗶𝗏 or hemoglobin A1C. It's a test of your 3 months control of your blood sugar.
Okay.
So the normal value is below 5.7, and diabetes can be diagnosed if your 𝗥𝗶𝗏1C is equal or greater than 6.5%.
Okay. So, doctor, you recommend that, you can do at least 2 tests because the first time, it can be highly suspicious if it's over 125, your blood sugar. But, maybe you're being sure, okay, let's take another one. After 3 months, maybe you can control your diet, or something. And then you'd give that advice. And then after 3 months, you can take the HbA1c. Doctor, is the HbA1c, do you have to fast for that, or?
No, there's no need for fasting for HbA1c.
Okay. And then if it's 6.5, then pretty much you can get diagnosed with diabetes.
Yes.
Okay, doctor, what's that test where they make you eat and then after 2 hours they take your blood sugar?
That's a test for what we call the postprandial. But usually it's not a gold standard for diagnosing diabetes. What the other test that usually is a gold standard is what we call the oral glucose tolerance test. Wherein the patient will fast also 10 to 12 hours, and then in the morning we get the fasting blood sugar again, and I said it should be below 126. Actually, the normal blood sugar is 99. So if you go over 99 but below 126, there is another category which we call pre-diabetes.
Pre-diabetic.
Yeah. So you're not yet diabetic, but you're also not normal. So in those cases, you can still prevent it because it's still reversible. No?
Okay.
So going back to the OGTT, the oral glucose tolerance test, is that we fast and then you get the blood glucose 2 times. The first is the fasting, which should be below 100, and then you are given something very sweet, glucose water, that 75 grams. And then after 2 hours, they get your blood sugar again. If the result is 200 and above, and your fasting is also elevated, then you are also diagnosed to be diabetes. So those 3 can confirm that you are diabetic.
That's great that you're very thorough, doctor, and that you explained everything, and that it's not just a one-off test. I'm so happy that we have doctors like you who can really make sure that okay, you're pre-diabetic but you're not yet diabetic, and you mentioned which the ones that are the gold standard for seeing if you have diabetes are the tests that are that way, and so that the audience can also see that it may be a longer process, but a doctor like yourself can tell someone, can be sure and tell someone whether they have diabetes or not, and not just prescribe medicines right away or whatever it is.
Because being diagnosed as a diabetic is a very big thing, because it will really affect your life. Because some people are refused employment because of diabetes, and also some people will have too much anxiety when they are diagnosed diabetic. So diabetes diagnosis is not to be taken lightly.
Yes. Thank you, doctor. And, I can see your concern about when you mentioned that some people will be refused employment. That's another topic related to this, but maybe we can discuss it later.
Some other time.
Yes. That makes me a little bit, I want to fight for the rights, but okay. We have to inform people about diabetes now. So, doctor, how do you treat diet? Oh, before I ask you that question, you mentioned that a normal blood sugar would range up to 99, and from 100 to 125 years pre-diabetic. Once it hits 126, then you have diabetes. What's the lowest that your blood sugar should be?
To be lowest, to be normal?
Yes, because some people might have low blood sugar, the opposite problem.
It should be not below 80. Not to be below 80. Although in pregnant women, it is usually lower. They go as low as 60 and still considered normal.
Okay. All right. Okay. So, doctor, how do you treat diabetes, and what are the different types of treatment?
Treatment of diabetes depends on the type. Type 1 diabetes is usually treated only by insulin injection. Okay. Without insulin, they cannot live long, and they will develop complications like diabetic ketoacidosis or diabetic coma. So they should be on insulin forever. That's type 1. But the type 2 diabetes has the treatment is mainly, as I said before, lifestyle. So the first thing is first you should accept that you are diabetic. Secondly, you should be educated. You should be educated on your illness. You should not do it by yourself. You should know what your illness is and what is causing your diabetes, and what can you do. How can you help your doctor treat your diabetes? That's why that is our main thrust in our center. Our main thrust is educating the diabetics so that they can cope with their illness scientifically and accurately. And
that's important.
Yes. And the second is diet, exercise, monitoring, so those things. And if those things do not work, then we have to treat the patient. Either we give them tablets There are several kinds of tablets that can cure diabetes. There are actually a lot of improvements now, a lot of new treatment available for diabetes. And also, if it still doesn't work, then we have injectables. Before insulin, we have what we call the GLP-1 agonist that we give only once a week, and usually it is very good for the patient. And of course, we have also, even if you are type 2 and you are not controlled with all the measures like the lifestyle, the tablets, then you are also given insulin.
Okay. Yeah, that's why there are people that I see who have type 2 diabetes, but they take insulin injections already. The other ones take meds, and the others are just kind of trying to control it. That's why. So thank you for that explanation, doctor. So as you said, first, we must get the patient or person to accept that they have diabetes. And secondly, your goal is to educate them, especially through your diabetes care center. May we ask where that diabetes care center is exactly? Where is it located?
The diabetes care center is located in the Ayala North. So, A&E, we call them, in the building next to us.
Yes, the building next to you.
Yes, and that is in the 7th floor of the A&E.
A&E, okay. Very easy access.
Yes, very easy.
Okay. Thank you. Okay. Doctor, we'll get back to you, and we'll just talk to Dr. Mary Lourdes David for a couple of minutes. We just have to take a quick break. Very short reminder, and then we'll be back and we'll talk to Dr. Mary Lourdes David, and later on we'll talk to everybody all together. So stay tuned to Helpline with Makati Med.
Thank you.
Thank you.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
This is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, everybody, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. It's an exciting day for the show because for the first time for this season, we have 4 guests, and we're going to talk to all of them at the same time later. But right now, we're going to talk to Dr. Mary Lourdes David. She's an endo fellow. And doctor, how are you today again?
Hi, I'm doing great. How are you?
I'm all right. Doctor, when you say an endo fellow, that's an endocrinologist. Is that your specialty?
Yes, I'm training to be an endocrinologist.
All right. Okay. So, doctor, why are endocrinologists treating diabetes? We just want to see how endocrinologists are they always the lead doctor? If I mean, you have to be an endocrinologist when you really want to get to the heart of diabetes.
Well, diabetes can be treated by internal medicine specialists, but if the diabetes gets uncontrolled or there are presence of complications, then it would be better or more prudent to refer to an endocrinologist.
Okay. So Dr. Macy, on who we talked to earlier and who will come back and who will have back on the screen, has both. She's an internist and an endocrinologist. Okay. So Dr. David, what are the complications of diabetes or the possible complications of having diabetes?
Okay, so for the diabetes complications, you have two. So you have the macrovascular or the complications for the big blood vessels, and the microvascular for the affectation of the small blood vessels for the small nerves in the body. So for the big blood vessels, they're the ones that you find in the brain and in the heart.
Okay.
So the complications of which will be stroke if it occurs in the brain, or heart attack, or heart attack if it occurs in the heart. So for the microvascular complications, these are usually the small vessels. So you find it in the heart, you find it in the eyes, the kidneys, and then the nerves in the feet.
Okay. All right. So that's why when we know people with diabetes, I mean, we hear that, oh, you might get a diabetic stroke, and that because, as you said, the complications could be what you were talking about, macro vessels, meaning big vessels, and that would be the heart and the brain, the big vessels there. The diabetes affects those. And you said micro vessels, smaller ones, you said in the kidneys. That's why we hear of diabetics who have to eventually get dialysis, and then also the feet. I remember years ago, a bunch of, like, when diabetics couldn't heal in their feet, they would end up without toes.
Yes, they would get amputations or wounds that wouldn't heal. Or the classically what we know of, they couldn't feel. They couldn't feel with their feet. So those are the complications. Yes.
Sorry, why does the diabetes affect the blood vessels in the brain and the heart?
Okay, so it's more because it creates what we call as byproducts. So these are the reactive oxygen species, the lining of the blood vessels. So when these blood vessels, the lining gets affected, so they get more prone on having blockages and constrictions that can cause those cause ischemia. Ischemia meaning because of the blockages and the constrictions in those blood vessels, then blood couldn't flow. There's a decreased blood flow in those organs. That is why you get those complications.
Okay. And for the micro, why
the same.
Okay.
So it's also the same. Like, for example, for the blood vessel, the little blood vessels in your eyes. So if it gets constrictions, then blood wouldn't flow smoothly. Then you will get ischemia or decrease oxygen to the vital areas of also the kidneys.
Okay. All right, doctor. Yeah, we in the past, I have heard of people whose eyesight had been affected by diabetes, or they've even gone blind. So when we talk about complications, today, are there tests to screen for complications like that? Like, oh, this is happening, this part of your body or your organ is already being affected. Are there tests for that, doctor?
Yes, definitely. So now we have available tests that can screen for those complications. So let's start with the eye. So we have we can take a fundus photo. So we can actually take a picture of the retina, or what's behind the eye, to see the blood vessels in it. Okay, so it will tell us if there are little hemorrhages or bleeding in the eye, or there is ischemia or decrease in blood flow. So that can give us an idea of how the back of the eye looks like. Because most of the time, patients with retinopathy, they don't normally complain of vision loss right away.
Yes,
okay?
yes.
Sometimes they would often say, "Oh, you know what? If you ask them how your eyesight is, they will say that it's fine." But when you take the fundus photo, okay, you will see that there are so many surprises. There are
Yes.
so many ischemia, and there's so many hemorrhages in the retina.
How do you
That's
take that
important.
photo?
Mhm.
How do you
So for
take?
the fundus photo, before it used to be a dilated fundus exam, so with a machine, a handheld machine, and then the doctor checks it right, through that machine. But now we have it in our eye center that we just put some medication to dilate the eye, and then it can take a picture, and it will give us a wide picture of the retina.
Well, doctor, if a patient, for example, went to their eye doctor, and their ophthalmologist, and they were complaining of like maybe some irregularity in their vision, would the ophthalmologist do this test right away and refer them to you, or is it something that they have to confirm that they have diabetes first before the
Okay.
ophthalmologist does it?
Actually, usually it's the other way around, or it could be both ways. So, if for patients with diabetes, we definitely refer to our friendly ophthalmologist who leads to check for eye complications. Also, when ophthalmologists catch these findings in the, let's say, the fundus photo, they can, they will suspect that this patient might have diabetes, so they will refer these patients back to us to manage the diabetes.
Okay. And then, doctor, we started talking about how to screen the eyes or how they're screened. So when it's checking the eyes, it's just as you said, dilation, and then they can take that photo. And you said there are many surprises because it's not the first that comes to mind when you have diabetes or when you maybe don't even know you have it. What are the, how do you take, how do you screen for complications in the heart or the brain?
Okay. So for the other, let's say for the heart and the brain, so there are other risk factors aside from diabetes. So the ones that we mentioned earlier, the screening for the blood sugar is important because that's control the sugar. Which is important. Okay, so that's screening for the indirectly screening for the heart and the brain. Other screening that we can do is one for the let's say for the kidneys. So most of the time, I'm sure a lot of people would hear about creatinine, right?
Yes,
The blood test for the kidneys. So usually, for diabetics, it might come out normal, and you just say, the creatinine is normal. But another way of finding out if there's early signs of diabetic kidney disease would be the measurement of your urine albumin creatinine ratio. So we take the urine sample and then we check for little amounts of protein. This will signify affectation of the kidneys. It's an early sign. That's why it's an important screening that we do to our diabetic patients. So,
okay, doctor. So basically, if somebody actually gets regular, your regular checkups in a week, or of course, like it's called an executive checkup, but you don't have to, like, if you get normal, regularly, like you get your blood taken with, maybe with a SPEC 23 or something like that, that type of blood test to check all of this. And you also get a urinalysis and a fecalysis. You could start detecting things, or you get your eyes checked, even if it's once a year, and you could maybe start catching it. Do you think that's okay? Do you think that?
Yeah, definitely. Because with let's say if one goes for regular checkup and you can screen yourself for diabetes, and then also that executive checkup, you can have your blood pressure done. Okay, we actually make basic eye exams.
Yes.
So yeah, those are also simple tests that can be done to detect early signs. But the ones I mentioned are more precise measures for patients with diabetes.
And doctor, I'd just like to clear this with the audience. The ophthalmologist is different from the optometrist. Nothing against optometrists, but saying they can't do these tests in the, when you get your new glasses.
Yes.
Yeah,
because these would need machines that are usually in the hospital or in specialized eyes
Okay, so thank you for that information, doctor, and for clearing it up. So, doctor, when should you consult a doctor for a screening test if you have suspicions, like perhaps what are the things that people that you've come across who have diabetes, like what were their symptoms or what made them go to you in your experience, and when do you advise a person to consult a doctor to screen for complications for diabetes?
Okay. So first, for patients with diabetes, we screen them for complications usually at the first visit, because when someone is diagnosed with diabetes, like let's say type 2 diabetes, the diabetes has been there for quite some time. So it just showed itself like now, but it's been the effects, the bad effects that it does in the body has been going on for, let's say, 5 to 10 years. That's why by the time that we get them or we see them, we check immediately for these complications. We check them for any eye problems, for retinopathy, for neuropathy, and for kidney disease. Okay, so at the first checkup, we check them for diabetes. Now, another question is, when do we screen for, let's say, normal person? How do we screen them for diabetes? So, newer guidelines now state that Filipinos that are 35 and above, we screen them for diabetes.
35 and above, automatically?
35 and above with the risk factor. Let's say you have a family history of diabetes, or you're on the heavier side, and then you have less physical activity or sedentary lifestyle.
Guilty.
Or for women, those who had meaning they had diabetes while pregnant, but no history of diabetes before pregnancy. So those are risk factors that when we would say a patient who was not previously known to have diabetes, and then on review of their medical history and physical exam, we see these risk factors and then screen them for diabetes.
Yes, actually, doctor, I'm happy you mentioned that, so that people are more aware about women who are pregnant, because I know a number of women who discovered that they were diabetic when they were pregnant. No, okay. So why is that, doctor? Why can being pregnant, or how can
diabetes?
Yes,
it's because of it's because of the placenta. It makes you it makes the pregnant woman resistant to insulin.
Oh, okay.
So they have the insulin, but because of the placenta, because of the baby, it creates an insulin resistance to the mother. That's why
I'm glad you explained that, so that it's the actual scientific explanation and not just like, because I ate the common misconceptions that I ate too much when I was pregnant, or their cravings or whatever it is, and then they start dieting when they're pregnant, and they may not be dieting the right way. At least you explained that it's the placenta. It has something to do with that. And then, doctor, for example, if people have diabetes, and they're your patients already, and they get pregnant, do you watch them more closely? Is that a risk? Yeah, a risk factor?
Yes, definitely. Because if, let's say, let's say a woman who is diabetes and then gets pregnant, her blood sugars might go higher because of the pregnancy. Okay, so that's why we check them almost sometimes every week, every 3 weeks, to watch them closely.
Okay, so doctor, along with I guess this is part of the medical nutrition therapy that we're discussing. Perhaps how can a person with diabetes prevent complications? First, from your point of view, and then we'll talk to 𝗏𝗏 who was a registered nurse delegator, no? Because R&Ds, and then we can discuss like some of the medical nutrition therapy. But from your point of view, generally, how can a person with diabetes prevent complications?
Okay, so for me, this is what the thrust of our society is: apat dapat. So apat. So actually, first, diet. It all boils down to diet. Okay, so portion control, and then exercise, physical activity. So that's very important to control diabetes. And then your medications, of course, your compliance to your medications is important. And then doctor's visit. So these are the integral parts to control
Mhm.
control diabetes and control its complications.
Mhm. So they're basic. Okay, basic. I've been around the people who speak Spanish from Madrid too much. Okay, so the basic. Sorry, guys from Madrid. So when it comes to it's the basic stuff again that even Dr. Season reminded us of earlier, and that's a lot of doctors kind of remind us of every week. It's eat healthy, or have a balanced diet, and then exercise, and what else did you say? Kind of the same.
Compliance to
Compliance to
medications.
medication.
Yes, medication.
A lot of people don't want to comply with the medications. I know. I have, yes, but if you have medications already and you are diabetic, then you must or you should take them, and also follow any diet types of therapy that Miss Ivy Ramalosa will be talking about, and also try to exercise. I do have a question, doctor. What if the person is not mobile or older when it comes to the exercise portion?
Okay, so for example, for let's say bedbound patients, okay, so who are really let's say very frail, so we don't give them vigorous exercises anymore, but we can. But it depends on the activity. Some patients can do simple exercises in the bed. Okay, let's say moving their arms and extremities.
Yes.
And then when someone who has diabetes and are, let's say, frail or already frail, and we have the complications already, we try to we try not to be very aggressive with controlling the sugars anymore. So if, let's say, for patients who are active or younger, then our goals would be for the HbA1c, let's say 6.5 or less than 7. For elderly, we just make sure that they won't have hypoglycemia or low blood sugar.
Yes.
That would be more detrimental to them. Yes.
Yes. Can you talk about hypoglycemia? Because
so
that's the other thing, low blood sugar. Yeah.
Yeah. So the Dr. Season mentioned earlier that any blood sugar lower than 80, we avoid going to that, right? Or at least lesser than 70. Because that can also be detrimental for the heart. So that's why we as endocrinologists, we don't like hypoglycemia. That's why it's very important for you to be compliant with their medications and follow up. Because sometimes people, they get lost to follow up, and then they take their medication. Sometimes it's too much already, right?
Yes.
Or something has changed within their body, within their bodies, and it's no longer appropriate for them, so they might have this effect.
So follow-up visits are also important in reporting any changes you feel. And also, doctor, I'd like to stress to the audience about the dangers of low blood sugar or hypoglycemia.
Yes.
Because everybody knows we're not supposed to have high blood sugar. I mean, it seems to be very, very spread out there, the knowledge. But when it comes to low blood sugar, you can die, right? I mean,
yes, you can
go too low, you can die.
If it gets persistent, yes. That's why it's important for us to know the signs of hypoglycemia. So normally our body would warn us about it. So we would feel have full clammy sensation, sweating, or sometimes you would get dizzy. Okay, or actually you would feel hunger.
Okay,
hunger and dizzy. Okay, so that's your body's way of telling your blood sugar is low. So you have to tell your doctor if that happens.
Okay. And at the moment, one way to treat it would be to eat something with sugar.
Yes.
Or to take a drink. Yes.
Hypoglycemia can be or juice.
Hypoglycemia is I mean, you said if it goes below 80, you're already experiencing low blood sugar, and if it goes really low, you can go into a coma as well.
Let's say if your blood sugar gets less than 50, so one might not wake up. Okay? So that's why it's also important for caregivers of patients who are. It usually happens to or people who are more at risk of getting hypoglycemia would be the elderly. That's why with for those patients, we are more careful with hypoglycemia.
Okay. All right. Okay. So thank you for answering that question and expounding on it, doctor, because a lot of people are not quite aware of the dangers of having low blood sugar. Baka matuwa pa sila, ay mababa, pero thank you for finding.
But not too low.
Yes. Not too low. And you also mentioned caregivers of patients who are diabetic or just maybe older and they cannot express themselves so much, like
Yes.
like I'm hungry, and they may be sleeping, and you have to make sure and the danger there is that they may not wake up if it's low. If it's low. So yeah, I mean I have had an experience wherein I've seen that, like the EMT, hey, don't sleep, telling someone don't sleep. I was there.
Yes.
With that person, and they kind of like, it seems like it's dramatic, but it seems like a TV thing, but it's not. It happens. Like they slap the person a little bit, like, please don't sleep, and they're pumping the glucose in because the blood sugar was too low. Anyway, okay, doctor. We're just gonna take a short break. Thank you for giving us all that information. And when we come back, we will talk to 𝗛𝗲𝗹𝗁 and talk about medical nutrition therapy, which is something that you and Dr. Season were talking about, and also to Margarita Montealegre about after a couple of minutes of talking with Ivy, we'll talk to her about how to inject, because a lot of people don't know and they're afraid of injections.
Yes.
And at least we have these two guests here who can tell us all about it, because they're doing it all the time and they're educating people on how to do it. Okay, so we're just going to take a short break. We'll be right back, and then we'll have all four of you together. So everybody, don't go away. We'll be right back. Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗥𝗲𝗁𝗵𝗹𝗆. Available for outpatient care services, our 𝗥𝗲𝗁𝗵𝗹𝗆 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗥𝗲𝗁𝗵𝗹𝗆 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗥𝗲𝗁𝗵𝗹𝗆 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗥𝗲𝗁𝗵𝗹𝗆.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Oops, I forgot to unmute. Hi, everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. Okay, outside, by the way, you guys, is it raining outside, for everyone? Hello, 𝗛𝗲𝗹𝗁𝗵𝗹𝗆. What should I call you? What's the proper nurse, Ivy or?
Just Ivy.
Ivy. Okay, yeah, I'm just Nicole also. Ivy, is it raining where you are? Like
I can see.
You can see. Okay. Yeah, the rains have been, they've been quite intense in the last couple of weeks. But okay, so thank you, Ivy. So you are in R&D, which does it mean registered
Nutritionist,
sorry.
dietitian.
I thought okay. Registered nutritionist,
Dietitian.
dietitian. Okay. That is great because we can talk to someone who always deals with this, and you're the expert on it. You're the subject matter expert. So, Ivy, what is MNT, or medical nutrition therapy?
Okay, ang medical nutrition therapy is defined by American Diabetes Association as nutritional diagnostic therapy and counseling services for the purpose of disease management. Now, while the Academy of Nutrition and Dietetics, formerly known as American Dietetic Association, defines MNT as supportive process to set priorities, establish goals, and create individualized action plans which acknowledge and foster responsibility for self-care.
Okay.
Wow, so mas bongga.
Pero basically, what I get from that, and please correct me if I'm wrong, is that you're there to, well, you did say establish goals, no? But you're there kind of help to organize and help, you said establish goals and individuals. You're there to educate individuals, especially patients with diabetes, and maybe their caregivers also, or their loved ones.
Yes.
Their
Or
family
even the one who prepares their foods.
Yes. Oh my God. They are so hard-headed. Sorry, guys.
Yeah.
Some sugar. Ay, kawawa naman. Let's put some salt. Yes, I know what you mean. Okay. So so you're there to educate everyone basically about who lives with a diabetic, who cares for the diabetic, about their disease, and make individualized plans. When you were talking about goals, no? What exactly are the goals of MNT? Like, when you do that, what's your basically, what are your goals, or what do you want to really achieve for each patient?
So the goals of medical nutrition therapy for adults with diabetes are, number one, to promote and support healthful eating patterns. Okay? So healthy dapat yung eating pattern niya. Nag-emphasize kami more on the variety of mga nutrient-dense foods. No, with appropriate portion sizes. Yun, tinuturo namin yung tamang portion sizes. This is to improve overall health, no? Kasi ang isa sa mga goals natin dito is ma-achieve and maintain yung body weight goals, ma-attain din yung individualized glycemic control, yung blood sugar levels nila, including yung blood pressure kasama dito, and also yung mga goals nila sa lipid profile nila, let's say cholesterol nila, triglycerides, ganyan. And yes, and to delay or prevent, of course, the complications of diabetes. And number two is ma-address din yung nutritional needs nila based on their personal and cultural preferences, no? Tsaka yung literacy nila sa health. So baka hindi maintindihan yung aming tinuturo. And access also sa healthful foods. Kasi baka naman recommend ng mag-adlay ka, mag-inwa ka, wala namang available sa kanila. Yes. Yes. Of course, their willingness, no, and the ability to make behavioral changes and yung existing barriers. So kailangan ma-identify din namin yon, yung mga barriers dito. And number three is to maintain, of course, yung pleasure pa rin of eating, no, by providing non-judgmental messages about food choices.
Yes.
No? Kasi alam nila pag diabetic parang ang dami na agad bawal. So pupunta sa'yo parang alam ko marami na kayong ibabawal. So we avoid it, yung mga ganong message sa kanila. And then number four is to provide, no, individual with diabetes with practical tools, no, for developing healthy eating patterns. So ma'am, hindi na diet yung tawag natin ngayon. So it's a healthy eating pattern.
Healthy eating pattern. Okay.
Yes.
So so when it comes to a healthy eating pattern, first, pwede kitang tanungin, ano ba yung healthy eating pattern na well, is it like eating every 3 to 4 hours para tama lang yung pag-release ng or
actually ang mga recommended healthy eating patterns ay Mediterranean diet, healthy eating pattern, DASH diet, which is parang diet to stop hypertension, and also the vegetarian or plant-based diet.
Plant-based. Okay, so
Yes.
yun yung pattern. Meron bang time? Or is there a time?
Actually, ma'am, wala po kaming time. It depends on, kasi yung, like for example, mga call center patient, sa call center na patients, so hindi mo pwedeng i-suggest yung ganitong time kasi their shift is
Right.
different, no? So, usually the timing of the meals depends on their lifestyle. But what is important is, they should eat at the same time. Let's say, for example, yung patient hindi talaga sila
Kain na
mag-breakfast.
kayo.
Let's say hindi sila mag-breakfast. So let's say ang first meal nila is at 9 or 10 a.m. Okay lang yun sa amin, basta every day it's 9 or 10 a.m. They should
Okay.
eat at the same time every day.
So, consistent dapat.
Yes.
Every day, okay. So,
Yes.
and then you were talking about, so it's either plant-based or this or that. Paano kung may allergy yung mga patients, let's say, okay, give me a basic of what you recommend in terms of red meat, blah, 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 all those kinds of things that we hear. Kaya people don't, like, yung pagbabawalan ako niyan, okay. And you give non-judgmental support. Okay.
Yeah,
So,
everything you eat naman will be part of an eating pattern, anything you drink, no? So, but when we do the counseling, we don't say bawal agad yan. So, for example, yung patient, tinanong mo siya, ano po yung kinain yung breakfast ngayon? Kumain ako ng 3 itlog, tapos 10 pandesal, and then ako 3-in-1 coffee. So parang, hindi mo sabi parang, dapat cholesterol lang pa nagkakain mo, ganun. So you tell them na 1 egg yolk has 275 milligrams of cholesterol, and then our goal is less than 300 milligrams. So sila na yung magsasabi na parang, so I ate too much. So dapat pala isa lang. So ganun. And then, tapos sasabihin mo, sir, ma'am, yung 2 pandesal is equivalent to 1/2 cup rice na po yan. So, wow! So, ibig sabihin, 2.5 cups of rice pala ako when I eat ganyan. 10 pieces of pandesal. So, things like that. So, lahat naman, hindi namin sinasabing bawal yan. It's just that the portion size is importante. Tapos yung frequency din, like for example, let's say mahilig siya sa red meat. So, hindi rin siya everyday na. Pinapayagan namin sila kumain ng red meat but not everyday. So, nagkakaroon ng variety and balance palagi.
And then Ivy, paano kung allergic yung patient sa ganito, sa ganyan?
Yeah, ma'am. Usually, pag allergic, kailangan natin talagang i-avoid siya. So, kinocross out namin yun dun sa handouts namin. And looking for substitutes, meron naman kaming list for other substitutes.
And as
then they can choose from.
They can choose from that. And then,
yes.
A long time ago, I went to a dietitian in a hospital, and they were like, you can't eat this, that, or you shouldn't eat this, that. Well, I'm allergic to so and so and da. Tas parang wala na. That was it. So it's like, but now you will find a way.
Yes.
And you mentioned also making sure that the patient gets the nutrition they need.
Yes.
Dapat masagana. I mean, nila yung dapat kailangan sa katawan.
Yes,
and also eating pleasure. So you take that into consideration.
Yes, of course.
Kasi, sometimes you have to give in a little so that the patient feels like they're not, as Dr. Season said earlier, it's a big thing to every aspect. And so that, as a patient, if you go and take if you do MNT therapy in Makati Med and with Ivy and her people, then, you can have a better quality of life and feel happy about things, even if there are certain things that you should watch out for or control. And then how does this MNT therapy, Ivy, how does it help in managing diabetes? Like to eat and empowering a patient to know for themselves.
Kasi ma'am, ang medical nutrition therapy is a very important component talaga of diabetes education and management. So alam naman natin, number 1 source ng sugar na sa dugo is coming from the foods that we eat, diba? So if we follow a healthy eating pattern, it can help us achieve our diet goals, no? Kasama dyan, of course, yung blood sugar control, control ng cholesterol, blood pressure, etc. And then when we meet our goals, we can help prevent the onset of complications. Kasi yun naman yung kailangan talaga nating iwasan yung pagkakaroon ng complications. That's why we manage talaga yung blood sugar.
Okay, and then what is the process when you do MNT? Ano yung proseso? Like, pupunta lang dyan yung patient? Or
okay. Usually, ma'am, for patients without referral from their doctors, we encourage and then interested sila to have individualized medical nutrition therapy. Usually recommend to get a referral from their doctors, especially ma'am kung may mga HMO, because some HMOs cover the fee for medical nutrition therapy. And of course, because para ma-address lahat ng kailangan nila during the counseling. Let's say, for example, yung patient pala mataas na yung cholesterol, mataas na yung uric acid niya, or may problem na pala siya with the kidneys. So lahat yun ma-address.
Hindi lang yung blood sugar na wag kang kumain na.
Yes.
Dati nakakalito para sa iba. It was confusing for others. Like one doctor would say, and rightfully so, no? Avoid this because your cholesterol is high. Then the other one will say, avoid this because it's sugar. Tapos, what will I eat na? Here you are. With the therapy to put it all together so that all of the illnesses can be addressed. Do you just take care of diabetics, or do you also do it for other illnesses?
Actually, for diabetes, meron kaming usually for diabetes, but we have the Weight Wellness Center kasi we're together then. So we cater then other patients, like patients with cancer, liver problem. Yeah.
So sorry, go ahead.
Yeah. Then for patients naman, ma'am, with a referral na from their doctors, we give them schedule. Then we do the counseling on appointment date and time. And counseling platform. So kung saan sila nag-agree, like is it online, via Viber or Zoom, or face-to-face?
Oh, okay, cool. You can also do Viber and Zoom.
Yes.
Now, okay, excellent. And then so, Miss Ivy, we'll get back and put you all together, and I'll get back to you in just in a bit. And then I'd like to ask about injectables. So AJ, can we put Miss Margarita Montealegre on? Okay, we'll just wait for that. Thank you, Ivy. Ang daming very, very
welcome.
Educational, nakaka-empower talaga ng pasyente yan, and that's important. Okay.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗲𝗄 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Okay, everybody, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto, and today we are talking to four people, four medical professionals from Makati, of course, about diabetes and how to manage it. We've talked about what causes it, what the symptoms are, how it's treated, the complications, and we've talked about medical nutritional therapy, which is one way to treat it, and that's through our intake of food. And now that I've run out of breath, we're going to talk about injectables because diabetics have to deal with injectables. So, welcome to the show, Margarita.
Hi, good evening, ma'am. Marga, ma'am.
Marga, okay, Marga. Can you share tips when it comes on how to inject insulin by yourself? Kasi that happens to a lot of diabetics, no? I mean, they have to inject it themselves.
Apo. Some tips that we give to our patients po, it includes po yung proper storage of your insulin, and usually we put it po on the vegetable compartment. Do not put it po on the freezer or chiller. Do not put it then also dun sa door kasi it changes po yung temperature every time we open the refrigerator. So pinaka-stable po yung temperature ng ref natin dun sa may vegetable compartment po.
So Marga, basically for dun sa mga hindi pa masyadong aware, yung our insulin na nabibili, where do we buy it una? Sa mga
usually po sa mga pharmacies po.
Okay. And they store properly there also?
Yes, ma'am. Kapag bagong bili po siya from the pharmacy, usually po it comes with a ice pack po.
Okay, ice pack.
Tapos when the patient arrives at home, tapos hindi pa naman niya gagamitin yung insulin niya, he needs to put it on the refrigerator.
In the refrigerator?
Yes.
Sige,
on the vegetable compartment, ma'am.
The vegetable compartment.
Yes. Tapos when the patient starts to use the insulin, and she can store na po at room temperature, iwasan lang pong magkaroon ng direct sunlight.
Okay. So, i-recap ko lang yung sinabi mo, magaling yung tips na yan kasi kung ano-ano lang, no? Yung, meron ng injection pack. So, pagkabili, may ice pack. So, when you buy there's ice pack, and then, when you get home, you should store it in the refrigerator, pero in the vegetable compartment. Tapos, ang ganda ng pagka-explain mo kanina, sinabi mo kasi like, if you put it in the door, every time you open it, it changes temperature. Di ba we like putting drinks in the door?
Yes po.
And then yung iba baka, sa freezer na lang, hindi dapat yun.
Hindi pa. Mag-freeze yung magkakaroon siya ng yelo, masisira po yung medication.
And these are good tips kasi also, some diabetics, they're taken care of by other people around them. Okay, so everybody remember that. Okay. So what about what if you're traveling? How should you travel with an injectable? Paano yung kunyari sasakay ka ng airplane tapos meron ka ilang araw, magbabiyahe ka, ganun?
If hindi pa po open, no need na pong, if hindi pa siya open, you need to store it in a cooler po. And kailangan meron siyang yelo. And usually they allow naman po in the airports.
That's your hand carry.
Ina-advise namin yung mga patient namin to bring po yung medical certificate that they are diabetic or the prescription para just in case lang po na question sila kung para saan po yun. They can show po.
Okay. And then, sige, so let's get to injecting, no?
Yes po.
How many times can you use an injectable? Is it just one shot or?
It depends po on the doctor's prescription. We have patients, they inject po before meals, before breakfast, lunch, and dinner. And tapos we also have patients, they inject only once a day.
Okay.
And either morning or in the evening po.
Yung injection, Marga, ano yun, ang tawag dito? Yung injection, kunyari ito yung injection.
Yes po.
I'm holding a pen for those who are not watching and just listening.
Yes po.
In this injection, is it just one shot? Like isang beses ko lang pwedeng gamitin? You can only
No po. Usually po, one pen po contains po 300 units of insulin. Yan. So, yung measurement po na ginagamit natin for insulin is units, not milligram or gram po. Yan.
Okay.
So, we call it units, international units po. Yan.
Okay.
So, it contains po 300 units. Depende po kung how long it will last. Depende dun sa dosage na ipaprescribe po ng doctors po nila.
Okay. And do we use the same needle? Not, I mean,
No po. You need to replace po the needle every time you inject. So, for example, you need to inject 3 times a day. So, you will use po 3 insulin needles po per day.
all right. So, okay. So, depende yun sa prescription mo. If you need to inject once a day, you inject it, and then you change the needle
Yes
already
po.
for the next injection. And then if you do it, you have to inject 3 times a day, well, then you change the needle to change the needle. So, if somebody takes insulin, they would have to have the injectable, the medicine in the injectable package that looks like a pen kind of, and extra needles.
Yes po.
Okay.
You
So,
need to buy po more needles, ma'am.
more needles. Okay. So, Marga, how do you inject when you use this device? Like, paano mo gagawin? Like, at saka, saan ka ba mag-i-inject?
Usually, insulins po are injected in the subcutaneous parts of our body or doon sa fatty areas po ng katawan natin. And bakit doon? Bakit hindi sa ibang parts? And para po yung effect po ng insulin natin is gradual or mabagal lang po yung effect niya. Hindi po tayo magha-hypoglycemia or hindi po babagsak bigla yung blood sugar natin.
So, pag subcutaneous meaning, okay, under the skin or nila. So, malaki ba yung needle? Para malaman.
Usually, it comes in different sizes din po. Usually, doctors prescribe po yung 4 millimeters. Yan. So, that's the smallest and the thinnest. Usually, no pain po.
Nowadays, wala ng pain. Parang ano lang. So, I mean, some good news for those who need to inject. At least, it's better than before. They're thinking of your
They before po they use po insulin syringes and the vials. You need to extract medication from the vial. So medyo mahirap siya kapag old patients. So now it comes with pens. Tapos meron na pong dosage window where iikot nyo lang po kung ilan po yung dosage na you need to inject with the patient. So, mabilis na lang po yung process. Then, you need to put on po the insulin needle po.
Okay.
Ayan.
So, Marga, when you said yung fatty areas, ano yung mga area yun sa katawan? Yung chan ba? Yung...
Usually po, injection sites for insulin po sa chan, at least po 2 inches apart. Yan, yung injection sites natin. And 3 fingers away from our navel po. And dun sa mga bony prominences po.
Okay. So, wag niyong isaksak yan sa belly button ninyo.
Malayo po dun sa puso.
Yung 3 fingers, tas away
3 fingers
sa belly button. And then, sa chan lang ba? May ibang
sa chan. But you can also use po dun sa may legs. You can put 3 fingers from dun sa tuhod, then 3 fingers dun sa may inguinal area, dun sa singit natin. So the distance po in between, pwede po siyang pagtusukan. Just put po at least 1 finger away po between injection sites po.
Okay, so like, correct me if I'm wrong, I mean, kunyari, I have to inject twice today. Pag nag-inject na ako dyan,
different
let's say hapon, I make sure na it's 1 finger away from the injects happen. Okay, thank you, Marga. That's really, really good practical advice. As for those who inject and for those who take care of those who inject. So you can like do it on the thigh, ganon, because it's fat near the singit, just a little bit away from the exact singit.
At least 3 fingers away po.
At least 3 fingers away. At saka yung, I'm very, you said earlier, you put it in the fatty part because you don't want the
blood sugar goes down po.
Pag sa ibang site na, sige, dito na lang sa muscle, mabilis yung epekto.
Pag sa muscle po siya na-inject, mas mabilis po yung effect niya. The patient may suffer po hypoglycemia.
Yes, yung low blood sugar, which is also dangerous. So, okay. So, no matter how high it is, kahit ano pang sabihin na, oh my God, sobrang taas yan, wag magmamadali, i-inject
Yes
doon
po.
sa fatty
Sa
sites.
fatty areas pa din po.
Can you share some tips on how to do self-monitoring of blood glucose? Marami yung mga techniques and yung frequency or timing, pero marami na rin mga gadgets nga, not
Opo.
gadgets.
May mga devices na po na
devices.
pwedeng i-ano.
Oo.
So, depende po sa capacity ng patient kung able po siya to buy the patch because we have patches po available in the market na ngayon. So the patient don't need to do finger pricks. Yan. So magkakabit lang tayo ng sensor dun sa arm nila tapos it comes with a reader. Yan. So they scan. Yan. Usually po mag-read na yung sugar nila. That device po you only replace the sensor po every 14 days.
Every 14 days, okay. So, okay. Just to, Margaret, di ba dati you'd prick the finger to check the blood sugar? And then, now they have, like, parang it's like a blade. It actually hurts less. No? Pero, pwede pa rin gamitin yun.
Pwede pa rin.
Pero meron ngayon bago yung patch na parang linalagay lang sa arm.
Apo, yun po.
And then, I've talked to someone, parang he doesn't really feel it. It's not like something...
It's not painful po kapag nilagay yung sensor.
And then, so the sensor is there, nandyan lang siya.
Nandyan lang siya for 14 days po.
Even when you shower, eat, whatever, sleep, nandyan.
Yeah.
And then, if your sugar goes down, it warns you. If it goes up, it warns you then.
Apo.
Ang alarm, ganun, tumutunog.
Usually meron po. You can set po kasi dun po sa machine, sa reader po, you can set po the target blood glucose. For example po, when the blood sugar po reaches 180, it alarms po. Tapos kunyari dun for the hypoglycemia naman, and if it's 70 below na, it alarms also po.
Okay. Thank you, Margo. Okay, AJ, let's put everyone on together now so that, we can talk about Makati Med's Diabetes Care Center, and I'm sure that everyone here, works there. And so everybody, I'm excited because this is the team. This is an example of the team that you will be dealing with or consulting when you go to Makati Med's Diabetes Care Center. And Dr. Season, back to you.
Hello again.
Hi, Doctor. Hi, Dr. Season. Hi, Dr. David. Hello, Marga and Ivy. Okay, so, Dr. Season, can you tell us more about Makati Med's Diabetes Care Center, its objectives, and...
Yeah. Okay. Yes. The Diabetes Care Center is actually a medical unit that specializes in providing care and support for individuals with diabetes. So these centers are staffed by healthcare professionals who have special training in diabetes. So you can have a bird's eye view of what we do here. As you said, we are a team. So when they first vouched to me that I will talk about diabetes and it's diabetes week, I thought about inviting all my staff, all representative of my staff, so that we can present to you. You will have a bird's eye view of what we really do in the MMC Diabetes Center. As you said, we work as a team. And we are, usually we have a staff made up. Me, I am the head. I am an internist endocrinologist, and we have also a diabetes educator, usually our fellows as Dr. David, and we have dietitian, special dietitian like Ivy, and we have also nursing educators, and we always work as a team. So the overall goal is to help patients achieve better control over their condition, reduce the risk of complication, and improve their overall quality of life. As you said, the services provided by the Diabetes Care Center, our objective is to give quality diabetes education. We offer educational programs, different. It could be group or it could be individual. to help the diabetic understand their illness. So as I said before, the first step in treating diabetes is for the patient to accept that they have diabetes. They should come to terms with the diagnosis of diabetes. And they can only have that if they are all educated on what their illness is and how to cope with this. So in the Diabetes Care Center, we don't really offer medical management. So we give care and support, and we collaborate with the attending physicians. No, so we help them. That's why they refer to us. So for symptoms, like me, as a endocrinologist, as a clinician, sometimes I will not have enough time, no, to discuss everything, because I give prescription. I cannot sit down and tell them, hey, this is the mechanism of your medicine, this is how I give you diet, this is how you should eat. But instead of doing that, I also refer my patients to the Diabetes Care Center in order to be taken care of by our team.
By your team, you all work as a team. So if you don't have time to sit down and educate on a certain matter, Dr.
So
David will handle it, and then
and the IV and our nurses, like that. So each of us has their own specialty. And of course, yes, go ahead.
Ever work with maybe psychologists or psychiatrists to accept the diabetes and come to terms with it?
We don't have psychologists inside, but we always have, we refer patients.
You can refer,
individual.
So it's a holistic
needed. Yes.
And I'm so glad, if I can just say, before I give you the floor for whatever you'd like to say, I'm so glad you have this, because what's lacking really is communication and education in a lot of cases, and a place for the patient to say what they need to say, and maybe also the caregiver to say what they need to say, so that everything can be put together and taken care of.
And they should have time to listen to what you are saying.
Yes,
because it's a individualized, it's a personalized approach, no, to the treatment of diabetes. Of course, our one of the main services that we have is nutrition counseling. You have heard Ivy talk about that, so I will not repeat. And also, it's something we guide them in the exercise, no, what exercise they can do, and we will have plans of collaborating, no, with rehab center, so that we can give specialized exercise within the hospital also.
Yes.
And of course, as you can see, you heard Marga talk about the glucose monitoring that is very needed. And of course, I, as a physician, will not have time to sit down and teach the patient slowly to teach my patient how to do the glucose monitoring. It will take most of the time, and Marga and the other nurse can do that.
But
we can also, yes, go ahead. We also do support and counseling. For example, they need access to other services. We teach them where to go, and also we teach them what to read, no, what references. They will be able to learn more about their illness if they need more information about diabetes, so that they will not go to sources which are not accepted. So at least they know what are scientific, no, and accepted treatment and theories about diabetes.
It's a great way to approach. Sorry, ma'am.
Go ahead.
We're actually running out of time, and I would just want to say it's a great way to approach the treatment of diabetes. If there's anything else you'd like to say or advice, please, the floor is yours, and then we'll
Yes. So for patients and their doctors who have treated, for patients, please try to educate yourself. You can come to us because sometimes it's hard to educate yourself.
Yes.
And also sometimes it's good to join a group education program, because you can interact with
Yes.
other people who have the same problem as you. And of course, who else can give you empathy
Mm-hmm.
but a co-diabetic?
Yes.
So that's
I feel like going there already, but I don't think I'm diabetic. So, but you know, I can feel it, the empathy, the group, everything, how you embrace it. I feel embraced tonight just asking questions. So thank you very much for all of your services, including the time you're allotting and the effort to be on the show. If there's anyone you'd like to greet or any last words, all four of you, go. Dr. David? Anyone you'd like to greet or say bye to?
Oh,
Okay, Dr. Season na lang. Okay. Dr. Season, any final words for our
so
audience?
yes. So we invite you. We invite the doctors who are treating diabetes to send your patients to us. And we invite the patients themselves to ask their doctors to be referred to us. Because as you can see, you already saw how we do our things. And we really work so hard to give the best education and support that we can in our MMC Diabetes Center.
Thank you so much.
Having said that, we thank you for having us.
Well, thank you so much, Dr. Season. Thank you, Dr. David. Thank you, Marga. Thank you, Ivy. Dr. Season, thank you for bringing your team on the show. I hope more doctors do it. And I do hope everyone checks out, everyone who it's relevant to checks out the Diabetes Care Center in Makati Med. Okay, well, that's it for this week, folks. Next week, 5 to 6:30 p.m. on Monday. This has been your host. I've been Nicole Jacinto, and we've been here with 4 other people. It's great. It's so exciting today. I hope you watch the show over and over again and learn about diabetes. We'll see you next week on Healthline with Makati Med. Bye, guys.
Bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and